The United States is one of the richest countries in the world. Its economy has grown much faster than Europe in recent years. But there's another kind of American exceptionalism. Americans are dying earlier. In 1970, life expectancy was close, but since then the gap between the United States and other similar countries has grown. COVID hit all countries, but it hit the US particularly hard and magnified an existing trend. It's not that old Americans are dying earlier. It is because America has a crisis of young people dying in midlife. And it gets worse because the national figures hide the level of inequality in American health. Coastal states like California have a life expectancy of 78, but in West Virginia it is just 71. If West Virginia was a country, it would rank 137th in global life expectancy between Cambodia and Libya. The biggest cause is now not racial factors, but educational attainment, with graduates living 6 years longer than those without a degree. Life expectancy is increasingly a factor of income, with only the very richest Americans having a life expectancy similar to European levels. The US spend more on healthcare per capita than anywhere else in the world. In recent years, per capita spending has soared. Health spending in America accounts for 17% of GDP, far higher than anywhere else. Yet the US remains an exception for spending so much money on health, but getting very poor life expectancy in return. For all the expenditure on healthcare, many Americans slip through the net. Nearly 100,000 Americans have medical debt, with healthcare being the biggest cause of bankruptcy in America. In America, drugs are much more expensive than in Europe, one of the most expensive places in the advanced world. America is the only advanced economy to rely on private insurance and not universal healthcare. Although the number of uninsured has fallen in recent years, many still slip through the gap. The profit-driven nature of healthcare in America has particularly hollowed out local hospitals in rural areas, leaving those in the poorest health struggling to gain adequate healthcare. When COVID hit West Virginia, many former miners who had existing respiratory diseases from coal were particularly vulnerable. But since 2005, over 170 rural hospitals have closed. Now, ironically, in some areas, US healthcare is the best in the world. It has higher survival rates for people over 75 because it is very good at cancer screening and survival rates. It has some of the best doctors in the world. The hit to US life expectancy occurs more in midlife, the young, the poor, those who slip through the safety net. Another type of American exceptionalism is in obesity rates. Excluding very small countries like American Samoa, the US has the highest obesity rates in the world, a reflection of poor diet, lack of exercise, and a food industry which has pumped high-corn fructose syrup into so many foodstuffs. America has become addicted to fat and sugar. It has caused rates of diabetes to soar, and this is a major cause of early death. American cities are built for the car. Public transport and walking are fairly limited. This contributes to poor levels of exercise and fitness, but also is a factor in the much higher levels of fatality on the road. Americans drive further. They also drive heavier, bigger cars, more likely to be involved in fatal accidents. And there's also a different culture with a greater willingness to take risk. A feature of American society since the late 1970s is that America has embraced deregulation much more than, say, Europe. In Europe, drug prescriptions are more carefully regulated, but in the US, the aggressive marketing of opiate-based painkillers like OxyContin led to an estimated 250,000 people dying from drug overdoses. But this also caused a surge in cheap heroin, fentanyl, and other synthetic opioids from people who became addicted to the legal painkillers. Annual deaths from synthetic opioids soared in the late 2010s, And it wasn't just the direct deaths from overdoses, but a rise in helplessness and despair, which led to higher suicide rates, economic stagnation, and a hollowing out of depressed areas. The US is also an outlier in terms of gun deaths, a reflection of loose gun regulations and strong gun culture. Compared to other countries, US gun deaths are off the chart, but it is unable to regulate even semi-automatic weapons used in mass school shootings. Deaths from guns continue to rise, used in both suicide and murder. Now, the US murder rate is actually lower than in the early 1990s, but gun murders continue to rise. Another feature of the US deregulation culture is that the US is slower to ban harmful pesticides. Of the £1.2 billion of pesticides used in the US, approximately 1/4 were pesticides that were banned in the European Union. There's a strong link between harmful pesticides and other chemical pollutants, and a rise in health conditions such as cancer and neurodegenerative diseases such as Parkinson's. The US has seen a 50% rise in the annual diagnosis of Parkinson's, and the rate is expected to keep rising. Yet, as the American scientist notes, America has still not banned harmful chemicals linked to the rise of these degenerative diseases. Although by the metrics of GDP per capita, the US economy is doing very well, it masks a growing inequality and a nation of haves and have-nots. Over 500,000 experience some form of homelessness. Average median wages are not much higher than 40 years ago, with more of the wealth going to the top 1%. The top 25 richest Americans received $400 billion of income, paying an average tax rate of just 3.5%. 61% of Americans, though, claim they are living paycheck to paycheck. 70% are financially distressed. Housing costs have eaten into living standards, especially for those having to rent at very high prices. Compared to Europe, the US has meagre unemployment benefits and sickness benefits. Americans work longer hours with less protection and less holidays. The federal minimum wage is very low, and the economy has struggled to deal with the decline of manufacturing jobs for non-graduate workers. All this is pretty grim, and it goes some way to explaining why life expectancy is significantly lower in America. Now, there are a few reasons to be a bit more optimistic. Firstly, America does have the wealth to tackle the problem if it has the willingness. Regulating chemicals, pesticides, taxing sugary food and improving road safety, providing universal healthcare free at the point of use, to the young and not just the old. The weight loss drug Ozempic may help reduce obesity rates and improve health outcomes in the future. And there are continual improvements in medical treatments, especially around things like cancer. Artificial intelligence could also be a new technology to help health care. But on the other hand, there's been a strong growth in neurodegenerative diseases, which currently have no cure. And also America is experiencing the effect of global warming, meaning that more Americans will face extremes of temperature and weather. Workers could face working in very high temperature, with access to air conditioning being a factor in determining health. Also, a lot of the health outcomes do come down to personal choices and culture. One of the biggest discrepancies between America and Japan, which has a huge difference in life expectancy, comes down to diet. America has much more processed food, high in saturated fats and sugar. The biggest difference an individual can make is changing diet and also taking more exercise. The biggest cause of death in the US is still heart disease. Increasing activity, even moderately, can significantly improve life expectancy and healthy life expectancy. In recent years, the government have tried to reduce the price of some drugs, such as insulin and asthma drugs. In fact, the cost of Medicare has grown less than expected, although that does actually partly reflect the decline in life expectancy and the reduced cost of treating people in old age. Beyond headline statistics of a booming economy, many Americans do feel poor, and healthcare is a very significant factor behind this. But there's much more to it as well, and this video goes into more detail in explaining the paradox of a rich country where people feel poor.